Hello, hello, mic testing, hello. Hello, do you hear me? Please reply on in the chat. One, anyone, Asia? Yes, please. Okay, welcome to Lakshman Institute of Medical Sciences, to the Department of Forensic Medicine. Today's class on duties of medical officer in cases of trauma or injury, a polytrauma, a case comes. What are the responsibilities of registered medical practitioner? And today I'm going to do this outline and objective today, just outline these duties and how to draft. Before that, the content of the own certificate. You know the definition of injury. That is the section 44 IPC. What is the trauma, assault, a battery in the last class. That because of time delay, I want to just skip this slide. What are the duties of medical officer in case of the trauma or in cases of the injuries? First is a treatment. Treat the patient. That is a fundamental duty of the medical officer. Do not allow him to die. Treat. And need a consent. If a patient is not in a condition to give the consent, there is nobody with the patient to give consent, consult the colleague. After consulting the colleague, take an opinion and treat, continue. A patient should be examined throughout the day or a night without any delay. And after this examination, I need to complete, that is a medical legal report immediately. It's to be prepared after examination is done. And another is that there is a no waiting for police formalities. Okay. Being the medical legal case is no bar for starting the treatment. Treatment is a fundamental duty of the medical officer. As per Supreme Court judgment in 1989, even a general practitioner has to treat every case of the injury and vehicular accidents. In case of sufficient facilities are not available at the treating center, he can just provide the first aid and refer the patient for the better treatment. That is a very important. First aid and refer and prepare the what has been given first line of treatment. That has to be prepared and sent along with the patient or his relative, or accompany the patient, or appoint one staff that will go along with the patient and to the higher center. Here has to be done MLC case. That MLC number has to be referred and that has to be documented in the detailed record too. If not, so just inform MLC has not been done under what the grounds. Refusing or treatment is considered as evidence of negligence and may even amount to being a party for the to the crime. Sometimes patient may come in a broad daylight condition. Then medical officer has to write the changes occur after death. What are the changes you see? That is a postmortem the rigor mortis. If a cardiac spasm is the that changes, you have to document. But do not prepare the own certificate here. Do not issue even a death certificate. Inform police and send the body to the mortuary for further examination. In a broad death cases, do not prepare the wound certificate here. That is considered about death, but only you have to write down in a case sheet that is a changes to estimate the times of death, calculate. One is the treatment, second is a second opinion. We are taking the opinion, a colleague's opinion as there is no consent is available, and another is consult in the case of the homicidal injuries. If you think that is MLC case is the injuries has been inflicted by others, so consult the colleague, take his opinion, document it. And documentation is a there is a in a emergency or casualty accident register is a maintained that it has to be entered the details about the patient. There is a preamble, name, age, sex, occupations, brought by whom, about at a date and time to name of the person about, date and time of examination, if a consent is available, consent, 2 mark of identification, and always note that if already patient has been referred from, you are the here tertiary center, higher center, and from periphery patient comes, just check whether the reference number, MLC number has been given, a date of request, or you are the other side, yeah, you are the primary health center, a periphery. So saying prepare a number, that is inform the police, your registration number is there, note that number, date and time, and intimation. We have learned that how to intimate the police in MLC cases. That intimation you have to prepare. History, take a detail about the history that weapon used, RTA is the road traffic accident, vehicle is involved in accidents, name of the assailant, time and the type of the injuries, a treatment received, and history of drug allergies, a past history. In all cases, if a patient turns serious, inform police. A patient likely to die, arrange the dying declaration. Even you can, while intimating a patient in the prima facie, when patient has arrived and you see very serious, intimate the police for as being the MLC case. Another you have to intimate another on the same, or that is arranged the magistrate for recording the dying declaration. If a sufficient time is not available to wait for the magistrate, the doctor should himself record the dying declaration. If patient dies, do not issue death certificate. Inform police. Send the body for postmortem examination, or inform the police, that is for a necessary proceeding. In all cases, detail a record of the injuries, history, complaint, a report of examination, investigation done, prognosis, treatment should be maintained, record should be maintained, investigations. Even you are communicated, you need a further request to visit the scene of crime, the documentation, intimation, everything record has to be maintained. Ideally, injury should be photographed or sketches should be preferred. But for this photography, you have to take a consent, and then the consent should, in the consent, has to be given for photograph. Means here, take a consent for photograph in a consent. Accident register, all details should be entered in the accident register. That we'll see next slide, where it is maintained, and professional secrecy maintained. And prepare the injury report, and opinion has to be given. If injuries are not immediately visible, deep-seated bruises are there, hospitalize the patient, that is keep in observation room. It's take a time, 36 to 48 hours, reappears, re-examine and document. Observe the patient, and that is a 2 to 3 days, and prepare the injury certificate. What is the injury report, the own certificate? This is an injury report. This is a medical legal report. You have seen in last classes a difference between medical report, or that is a medical certificate, versus a medical legal report, also called the ML report. And you know the differences in medical certificate that contain only a preamble and opinion, and medical legal report preamble, opinion, but in the the middle part is the body of the report that contain proper examination detail, general examination, systemic examination, local examinations apart. You will find that an opinion has been given. Here medical uh, legal report, the own certificates, casualty medical officer or any other medical officer may be called upon to examine the injured person. And this is the pro forma. You will see the own certificate. What you find upper is the accident register, or MLC, a number, that space and 20 has been written. That is a accident MLC number. You have started in the 2020 year in the January 1st. And the first case is the MLC is then 01. That is the first case. It is slash, that is 2020. That will come numbering, and that is the second. The 20 means year 2020. That is in the year 2020, which is the MLC case number. That is a serially numbered place in that name of the hospital where you are treating, and date and time. The rest of the preamble you will find a name, age, sex, address, brought by him, at what time, his name, date and time of examination too. A medical practitioner should enter all details of examination in the medical legal register. That is, I want to say, the medical accident register is maintained in the hospital. That is, you have seen this one certificate, all the content. You may be asked Viva question or part of law examination. What are the contents of the own certificate? You know the preamble, name, age, sex, occupation, in office purpose, the MLC number, Tapali number, then examination proper, and general examination system and local examination detail. Investigations has been done, and final opinion, and who is the treating doctor, his signatures, particulars, date and time. And other important is the handing out this certificate. Even belongings of the body, the person, if have a retain, a viscera has been written, blood sample has been written, a foreign body in the wound is there, that has been written, that has to be handed over to the police. That should come on the report too. This is all content of one certificate. You will find the same in accident register. This is a maintained in the casualty. Do you see this? A ledger. It's a small file. It's like a newspaper, very big. If a one choir is having a ML register, accident AR register, that is written in the emergency room or casualty, it's weighing about 400 grams. One choir. If a multiple choirs are there, 6, 7, 8, that become ledger. It's the weight being the 8 to 10 kg, and it's maintained in the, and it is it is kept in the lock and custody and the casualty, and it is a protected one. So ledger, and what are the content of ledger is the same what you have seen in the own certificate, preamble, body of the report, even necessary investigation done, you're finding detail, but it is in a columns. Serial number, that's MLC number, name of the disease, sex, age, and all the content what you are written into here. You are writing all the detail in the ledger or the accident register, all the detail, and concise one you are preparing in this wound certificate. Okay. So detail maintained in accident register is the same detail. Has been written examination, even needed referred to the colleagues, other departments. Everything has been maintained here. Even advice, MLC X-rays, collected, received, even identification marks has been written in the ML register. Let's see the, you know the how to draft a wound certificate, name, age, sex, address. A consent here comes, you are taking a consent detail in an accidental register, but here you can write a consent has been taken or video consent has been recorded. But it is nice to, because you're a learner, you have to write multiple times, more and more, practice. So write in a certificate article, a record book to a detailed consent. And that is should be a patient vernacular. जैसे if a Hindi speaker is that मैं मेरी शारीरिक जांच के लिए सम्मति देता हूँ, a patient is देती हूँ, that has to be, you have taken consent for collection of the blood or radiological examination, photograph, and has explained the procedures too. Everything detail has to be taken and written here. If the female is the third, the witness, signature, name of the witness, minor is there less than 12 years, guardian's signature, name, and particular. So identification marks should be written in the detail, and 2 identification marks is a must. That is a medical legal dictum. And brief history, you are going to write here what is the alleged history of assault. You should know what is the assault and what is a battery. That one, that is alleged history of road traffic accident. That in a short and brief has been written. And on examination, this is a general examination, conscious, cooperative, vital parameter, temperature, but TPR within normal limit or not. You can write important findings in general examination. Systemic examination, you go and you examine and draft. Detail will come here, but here drafting, if you didn't find anything like a central nervous system, patient is a conscious, even unconscious, but you didn't find central nervous system finding anything. You can nothing, no abnormality detected. Once you write down complete sentence, no abnormality detected, in bracket NAD. Next time you want to write, just write the NAD. The first time you are making a short form of a word that is going to repeat it, you just make a NAD here. And this has been given. Local examination. A learner finds difficult how to draft. And what are the content again in the local examination? There are 2 parts has been mentioned. You just see that there are 9 columns are there. Serial number, nature of the injury, size in a centimeter. Always injury is documented in centimeter. Even any measurement comes, even height of the person is a centimeter. Anything, not never write inches or millimeter. Okay, in a centimeter, sight and direction. First 5 columns that is the observations. You examine patient and what you find your finding has to be documented. This is an observation. Rest of the are 6, 7, 8 the opinion, or you are going to make opinion. At the bottom has been mentioned opinion. That and these are the 5, 6, 7, 8, and this opinion is the opinion part. Let's see what has to be things to be documented here. Serial number 1, how many injuries? 5 injuries, that has to be serially I mentioned one by one. Let's see how many injuries are there. Sometimes maybe blow given at one point, and patient may complain that 5 blows has been received at the one point. But what you observe, your finding you write down. Nature of the injury, or some book has mentioned a type of the injury. That is one. When observation come, nature or type means you have to write whether this is abrasion, bruises, a laceration, incise wound, a stab wound, the chop wound, a firearm wound. This observation column again, when you see the injury, a type of the injury, and immediately mention the color too. That is observation column. And another, you find second half green block, that is opinion part. Here also comes, some book has been mentioned a type of the injury, that is simple or grievous, or nature of the injury. Don't get confused. If a type of injury comes in the opinion, that is a means simple argues. In observation type of injury means it is a injuries, mechanical injuries, or that is abrasion, contusion, lacerations, or stabbing, chopping. Size in its centimeters. You have to measure with a tape and write a size, even a shape too. That is mentioned in the LBW, length, breadth, width, or depth. If a stab wound is the penetrating, perforating wound, it is measured in the depth. If have a limitation, we express that your limitations to measuring the width. But length and breadth, 2D, two-dimensional picture, you can write it. Always write length is more than breadth. So if a 5 centimeter by 2 centimeter by depth is skin deep, a soft tissue deep, maybe bone deep, maybe cavity deep. But here measurements come in centimeter, you have to measure. But here we'll discuss in a small group teaching how to draft. This is a theoretical part, LBW in the fashion. Like site, give exact anatomical location. Where is it? You know the anatomy, the locations. If abrasion is there, except bruising, abrasion, you can write a direction to heaping of the epithelium. A tangential blow is there, abrasion. Perpendicular, sometimes you may not find a direction. You didn't write, that means it appears to be like that a perpendicular force has been applied. If oblique force has been applied, tangential force, grazes, you see scratches, at the end of heaping up, that gives the direction. Even laceration on the stab wound, chop wound, you find the directions too. So if you notice this, document that in that column. So how to write? Sometimes it is very difficult. The boxes has been given in small space how to write. Even you can write in a sentence, but everything observation finding has to come. Type of the injury, color, size, a shape, even site and direction. How example has been shown here, how to write. If, for example, a stab wound find on the stab wound on the thorax might be described as follows, using ordinary language to explain. Why the ordinary language? If you see on the back of the hand, carpopharyngeal joint, you find on the above over the you find the abrasion. So if you write the law enforcement authority in the courtroom, may not find very good. So it is better to write the knuckle. That is a good ordinary language, better. Even an ordinary language means the flexor aspect, extensor aspect. It is better to write a front or a back. That is the language you are going to write here. Okay. So here has been mentioned that is how to draft. If a column you can write or make a line in a sentence, a construct a sentence, an elliptical shaped stab wound of size 2.5 centimeter by half centimeter. That is the centimeters. Always we are writing, even you omit, but you write, mention the centimeters to cm. I've already mentioned in the size in centimeter, write in a column. But even writing a sentence, right, you write the in centimeter. Present on the right upper chest. That is a stab wound. Place obliquely with inner end lower than the upper end. Even you can write inner end and outer end, or you say the midline is there, medial. Inner means towards the midline, outer or lateral or medial end. You can mention the right or left side, the inner end or lower than the upper. It means you can imagine how the shape is there, oblique. And here has been 3-dimensional LBW, length, breadth has been mentioned, now depth. You wanted to say the stab wound. Depth is more than the length, means 2.5 centimeter more. So if you have the suspicion, so it is a stab wound or only just incise wound, the depth to be assessed in the operation theater. If something is protruding out, if the stab wound is on the abdomen and come through, protruded out to the defect, then you can say the cavity deep. But nothing is protruding out from the cavity. Just do not manipulate. Just it should be assessed in the OT. And later you communicate after being the surgeon. What is the depth? Sometimes it may happen in chest, a plane. A oblique stab wound is there, may not enter the chest cavity, may be in a muscle, a stab tissue, or maybe pouching under the skin. Depth may be more than the length. The center of the wound just above the line of joining the nipple, and that is has been anatomical mm, uh, presentation. The exact for how much distance from the midline, taking anatomical landmarks. So being 5 centimeter from the midline, 7.5 centimeter from the right nipple, and 15 centimeter below the center of the right clavicle bone. And always this stab wounds, road traffic accidents, homicidal, always measure the wound from the heel, height from the heel. So later you can communicate, you can make an opinion, a relative position of the assailant and the victim. So always mention that is each wound from height from the heel. That is obliquely present the inner aspect, how much, that one. Another, this is obliquely wound, it's stab wound, you have seen the angle of the wound, that is obtuse or it is a clean cut, that is a blunt or sharply cut. So you can decide whether the knife or the weapon, penetrating, the kind of the weapon, sharp-edged cutting weapon, that is double-edged or single-edged, one that is blunt, that can be decided. So that should reflect and was slope in the downwards direction, that has been come a tailing of the wound, sloping with the subcutaneous tissue visible along with the inside of the lung. This is a drafting in the observation, or you can make a small, and while presenting the courtroom, you present this one, what has been drafted. A telegraphic, your congratulations, but here the writing own certificate is a concise one, it's only congratulations, like yes, telegraphic notes has to be written in the own certificate, but detail is to be documented in an accidental register. Hope so you understand here. In the observation column, now is you will shifting to, it is opinion column. Opinion column, you see simple, that is type of the injury here or nature of the injury. Some standard textbook has been mentioned, that is simple or grievous. That has to be documented whether it's grievous or simple. Next column is causative agent, whether the hardened blunt, sharp-edged cutting, cutting with sharp pointed, or it is a firearm. Next column, looking at the color and the injury, already we mentioned in the injury column, that is nature of the injury, abrasion, reddish color, or scab present. Depending upon, you have to give the age of the injury. And what has to be written in the remark column, that is very important. You just write down, is it painful or not. What, you can mention in the color if there is a space is not available in the nature of the injury in observation here, and so you can remark the observation finding again, you write that suggest like color. A bleeding is there, profuse, a bleeding is stop, or a dry crust is around the wound is there. Is there any foreign body inside the wound? You have to pick up and return. Pick it up, take a file, keep it. That you will learn in a small discussion, small group discussion, and your practical demonstration, how to collect, preserve, and send to the further examination. Foreign body, has been collected or not collected, that has to be documented. That is main link to the chain, that is kind. Height from the heel of each injury, that can be written in the remark column, height of the wound, each wound on the chest, abdomen. That investigation advice, whether the CT scan has been advised. The head injuries, there ophthalmoscopy, ENT surgeon, investigations, X-ray, CT scan, MRI, sonography, blood investigation, whatever the investigation, and in telegraphic you're writing here, detail will be the accident register or indoor paper. Whether the patient is hospitalized or not. Hospitalized or just it has been just a minor injury, superficial, not life-threatening, and you have discharged. They're hospitalized or not. That's if a patient has been under observation, like a patient completed, he has received the blow on the back, and immediately rush to the ER room, the emergency room. While examination, you didn't find anything at that moment of time. So you just suspicious is either is lying or maybe true. So want to come to true, don't inform the patient. Hospitalize, keep under observation. You think, you remember here, deep-seated bruising, take a time to reappear. After that is 36 to 48 hours, 3 days, let you re-examine the patient and document what is the. So that is observation or hospitalize the patient. Consult the colleague. Whenever consult a colleague, they have just like that when there is a consent. Another is a homicidal injury. Always consult the colleague. Document his finding. Make an opinion. Immunize or not, that is very important. Ask the history. Recent past has been received a tetanus toxoid. Give the injection, not result than TB. Injection TB. That has to be managed, that has to be documented. Surgery done or not, that is the main, what is a final surgeon. Do not write detail of the surgery procedure here. Remark surgery, which kind of the surgery has been done, whether the minor OT or major OT. And sometimes you have to make a request to law enforcement authority. Road traffic accident has been occurred. So the history is not consistent of the body injury. You want to see whether in the later a court is going to ask whether the accident or hit and run case is there, or he has jumped in front of the vehicle and is suicidal a tendency, or it is a whether accident or intentional injury has happened, harm has happened. You want to know, so you can request law enforcement authority, please provide spot inquest, or you want to examine the vehicle or scene of crime, request. You can make a request, because in the future they are going to ask the opinion about the whether they inflicted by others accident, a road traffic accident, whether the smart. Sometimes you can request for the weapon, that's a knife, razor blade has been used. That can be requested. And a later phase, they may ask you the opinion about whether the accidental or intentional self-harm, or maybe it is a what a defense wound, or it is a fabricated asphyxiation. So remark column. Now here the question comes: a time, a takes. How much time take to investigation reports come? Radiological investigation report may come the next day, may not be available. But here, a law enforcement authority requests you a certificate to prepare immediate and give, mentioning your limitations in the remark column. And later, when you got a CT scan report or X-ray report, examine and prepare the final report, and that will be followed. So that is to be. So in the wound certificate, what you are going to write, that is in the what I mentioned here, the particulars to be written: serial number, admission number, that is very important. Particulars, good. Date and time of examination, who has a gout, by whom. If a police constable writes his name. And here very important, patient may come in unconscious, belongings. You collect, prepare the list and hand over to the law enforcement authority. Or sometimes that may be trace evidence linked with the crime too. Very important. Even the clothes, it work as like a skin, a body. A firearm injury, a suit, some stains, blood stain, very important. So that belonging has to be written. A number, that a patient unconscious brought that for the examination, name and address of the person bringing that patient is noted. Brief statement of the injured, has how it was hacker, that you can take in histories, size of the victim, stature, weight, build, robust or thin, lean, that has to be documented in your AR register. If necessary, you can present on the wound certificate to informed consent, that is very important, essential part. And condition, if I unable to give the consent, then take a colleague's opinion. If a patient condition is serious, a dying declaration should be recorded. Opinion has to prepare after writing all the details, body of the report. We'll do exercise in a next class, how to draft wound certificate. And last bottom call, this here, opinion has been mentioned. That is the opinion, medical legal opinion, whether this is a fictitious one, whether defense one, whether it is accident, self-harm, or inflicted by other has to prepare. If it's not able to give opinion, that can be expressed. Most of the time, this opinion has not been written. It has been expressed in the courtroom directly. And we're mentioning your limitations in the remark column. Handing out the report, that is very important. After completion, what are the things you are going to hand over and what instruction you are going to will give at the time of the handing over. This belongings of blood sample, look out of principle of exchange. That one you keep in mind. If IO has requested to retain a blood sample, you must retain with the proper preservative. Give or that foreign body you find that belongings that has to be handed over. Hand over this as a report and take a receipt. Receive the original certificate. You have to prepare the duplicate or triplicate, putting a carbon copy. Original is to be handed over to police, and the carbon copy will be your office file, main file. You can prepare in a later, and it is to be submitted in MRD. Take a receipt. That is very important moment. Exact at what time has been given. You know the certificate has to be when authorized person requests you a certificate, you have to issue within 72 hours. So that is very important. He has requested and you have submitted it immediately. That has to be. And finally, a report you have to give after collecting the blood examination report, X-ray, CT scan, and going through. A conclusion has to be drawn and has to prepare the survey. This is the outline. In next classes, we will work out on the how to draft wound certificate, taking a scenarios, a case scenario. So for assignments to you to prepare, because it's very important whether the injuries are simple or grievous. So this column we will take the topic next class, simple or grievous. One, in age of the injury already had, we will take again revision on the online class, this one. You find it difficult. In the beginning had this communication because it's the first time online class is going on. You just give the feedback. I know that voice quality, mine, you always complain on this online class also. Just give me the feedback. I'll make a better next time and on time schedule. Class will start. Have a doubt, you express in chat room. Thank you. Next class is how to draft the own certificate. It is case scenario. Online we'll discuss. Before that, if you have a record book copy, or I'll send a PDF file, own certificate, that you make a photocopy if available. If not available on white paper, you just make it with columns and be ready and draft and practice that one. And I'm not allowing to go outside. That is the message is that stay home, stay safe. If not available Xerox machine, or you don't have a printer at your home place, don't worry. Take a white paper and draft and practice. Okay, thank you.